Hello, I'm Sama. What's the difference between a physical therapist and an occupational therapist in terms of Ehlers-Danlos syndrome? Well, in general, a physical therapist looks at mobility, and they look at, so they're looking at how you move, um, what it looks like when you do it, how your body shifts its weight. They're looking along 3 planes of motion to see how often you are crunching your joints, and they're generally concerned with gross motor movements, so larger motor movements, walking, getting up, sitting down, um, putting on a backpack, for example, taking off your backpack. And they will also do a lot of manual therapies. So they'll do TENS, ultrasound, massage, heat, ice, stuff like that. Now, an occupational therapist may do some of the same things, but they're also more concerned with daily living and how you live your life, physically speaking. So they look at your activities of daily living, like bathing, getting dressed, preparing meals. They look at your environment. Are you reaching way down to get a pot out of the cupboard and then you pass out? Can you put the pot up a little bit higher somewhere? Can you leave the pot on the stove? Stuff like that. And they make adaptations to the environment with you. Other occupational therapists are concerned with the functions of your hands and the upper limb. Doesn't have to be, but it often gets pigeonholed into just dealing with the upper extremities, being the arms and some of the neck, maybe. When they work with your hands, if you have EDS, it may behoove you to find a certified hand therapist, a CHT. So a CHT is also an OT, which is occupational therapist, but they have they're concerned almost exclusively with the upper limb, and they're okay with that. They have a specialization in hand function, and you're more likely to get the right information about your hands and about splinting than if you go to a general OT, which is concerned with your environment and a lot of other things. You'll still get that comprehensive evaluation, but through the lens of protecting your hands first and foremost. So a physical therapist is a great place to start when you're looking at how am I moving? How am I shifting my weight? Why do I fall so much? Why do I bump into doorways when I'm going through them? What's the best way for me to get up and down the stairs? How do I get out of bed in the morning without dislocating, without passing out? Stuff like that. So that is it. It's been a long time and I'm out of practice. Bear with me. I will do my best to keep the videos rolling. Be well.